This week, out at the Rangiora Vet Centre, Martha's patient is in for a dental checkup.
So today we're having a wee look at Smooch. He's come in to have a dental check. We're going to give him a full check over, have a look at his teeth. Now, this fellow's 10 years old, so we're going to pop a wee IV line into him and grab some bloods off him, just to check that his kidneys and his liver are working okay before we think about doing an anaesthetic on him. He is a beautiful, beautiful boy, so we'll just have a wee look at you, sweetheart. Hi, darling. You're half asleep there, aren't you? Have a really good look at your teeth, Poppet. Yeah, so we've got some tartar at the back there and just a wee bit of gingivitis. So one of the things that we see in cats quite frequently is something called a neck lesion or a carie, and it's often a wee hole in the tooth just really close to the gum line, and you often can't see it until the cat's actually asleep and you've got the tartar off. And it does mean that usually you have to remove the tooth because it allows bacteria into that tooth. Good boy, let's have a wee look. So we're really just looking for anything that would make us not want to anaesthetise him today. So for example, anything that we hear in his heart that makes me think that he wouldn't be a good risk under anaesthetic, anything sore in his tummy. And we'll take his temperature as well and check that he's not running a fever too, but so far he's looking absolutely great. Okie doke, so let's see if we can pop a wee IV line in you, Smooch. Good boy, sweetheart. Good boy. What a brave man, hey? What a brave man. We've done the hard bit, we're just going to grab a wee bit of blood off that. Good boy, bud. A bit more. Good boy. There we go. Okie dokes. Grand. And we'll just bandage that in. Good boy. So we're just going to bandage that line in. He's going to go back to bed for 5 or 10 minutes. We're going to run that blood sample, and then if everything's okay, we'll go ahead and give him an anaesthetic and take him through to dental. So today on Smooch, we've performed just a dental scale and a polish. He came in obviously earlier for a dental checkup. We had a really good look at his teeth while he was still awake, and they looked pretty good. There was a bit of tartar on the rear molars. Couldn't see any holes or any what we call caries or neck lesions, but often you can't tell until the cat's actually anaesthetised and you're looking in the mouth and got the tartar off the top. If we're concerned about a tooth but we're not sure whether it needs to come out or not, we do have the ability to take dental x-rays on our new digital x-ray machine, and we do that fairly frequently in cats and dogs where we're not sure whether the tooth is salvageable or not. So after his anaesthetic, he comes off the gas, we keep him on oxygen for about 10 minutes. He'll start to recover, he'll start to wake up. As soon as he's awake enough and he starts swallowing, his ET tube will come out, and he'll then go back through into one of our recovery cages, which is monitored by our nurses all of the time. So what we're looking for here is we're waiting for him to swallow for us, to move his tongue, so that we know that he's not going to inhale anything. So Kim's just checked and he's just done a wee swallow for us, and the tube's able to come out. Everything? Yep. Perfect. So he'll stay in recovery now for probably at least probably half an hour to an hour until he's sitting up and he's able to look after himself, and then he'll go back into the cat ward where there's a nurse looking after them 24/7.
Be watching next week when Sophie has Rascal the cat in for a checkup on his thyroid condition.